Yesterday, a tornado did cause damage in Olwine, including an apartment building, where 12 families were impacted and are being assisted by the Red Cross while damage is being assessed. A farm in Adair County also sustained some damages due to the storm, and we are just grateful that these families are safe and we will assist them in their recovery. Now for an update on the numbers of COVID-19 cases in Iowa. We had 38 new positive cases today for a total of 336 positive cases, 638 negative cases today for a total of 5,013 negative tests. We have 51 hospitalized as of last evening, and I am so sorry to report that we have had one additional death for a total of 4. The test available for individuals through the State Hygienic Lab is 840. As we continue to increase our capacity for testing at the State Hygienic Lab and other labs, more tests are being ran on a daily basis, resulting in higher numbers in positive and negative results. Over the last 2 weeks, we've taken significant steps to mitigate and slow the spread of COVID-19. We've recommended schools closed for 4 weeks, reduced gatherings to 10 people or less in social, community, faith activities, recreational, leisure, and sporting events. We've encouraged work from home when possible and social distancing, ordered many businesses to close, including restaurants, bars, except for carry-out, delivery, and pickup. Because of the incubation period of the virus, because it is 14 days, we've been expecting an increase of positive cases during this time, and we expect that it will continue as Iowans who have recently traveled for spring break and may have been exposed to the virus are still in that incubation period. It's also important to keep in mind that most people, about 80%, who get the virus will experience only mild symptoms and can fully recover at home with little or no medical attention. Regardless of what age or risk group you're in, it is so important that we all do our part to protect our fellow Iowans. Stay at home as much as possible, even if you're healthy. Limit your time away from home to trips for essentials like groceries, medications, and necessary supplies. If your children or you are sick, stay home. Contact your medical provider before going in. If your job allows you to work from home, do so. If someone in your household has tested positive for the coronavirus, keep the entire household at home. If you're an older Iowan or person with chronic health issues, stay home and away from other people. Today marks 3 weeks since we announced the first positive COVID-19 cases in Iowa. In that time, our way of life and how we do business has changed dramatically here in Iowa and all across the country. And just as Iowa families are adjusting to living and working and learning under the same roof, so are families in every single state. And workers across Iowa and America are facing the reality of suddenly being out of a job and worried about making ends meet and supporting their families, while business owners are wondering when or how they'll reopen their doors. The impact of COVID-19 is being felt coast to coast, and we are responding as one nation. For several weeks, my team has been working with our state agencies, local partners, elected officials, EMA, local public health and first responders, law enforcement, and hospitals and healthcare workers, the Iowa National Guard, the private sector, and other governors, along with Vice President Pence and the President's Corona Task Force. All of this in an effort to ensure Iowa was prepared and ready to respond. I've also remained in close contact with Iowa's congressional delegation, who have been working diligently at the federal level to ensure Iowans and Iowa would have the support it needs. Today, I'm pleased to have Senator Joni Ernst join me from her home in Red Oak to share her perspective of the coronavirus response at a national level and update us on the CARES Act, which the President signed on Friday. So thank you for joining us today, Senator. And with that, I'll turn it over to you.
Great. No, thank you so much, Governor. And I do appreciate your leadership. Just truly a tremendous job supporting and working for the people of Iowa and working with those of us at the federal level as well. And first, what I'd like to do to update you, I'll go through the various packages that we have passed at the federal level, and all of these items will, of course, help Iowans. That is our goal. Senator Grassley and I worked diligently and at quite a rapid pace to get the first package done, that Phase 1 bill, which was dollars, about $8 billion or more that was allocated to go to federal, state, and local partners. And, of course, our healthcare workers and making sure that those dollars were flowing into those systems. That was Phase 1. Phase 2, then, of course, we moved on, and that was very much focused on providing free testing for the COVID-19. That is the diagnostic testing that the governor was talking about, and access to food and nutrition programs for children and seniors. And then a significant part of Phase 2 was also making sure that our workers, our moms and dads, had paid sick leave, emergency sick leave, so that if they were affected by the coronavirus, then they would be covered for the time that they had to take away from their employer. Now, Phase 3 is the CARES Act that the governor was referring to, and that is the most significant package that we have had, and that is what the president did sign on Friday without delay. And so I have got a number of notes here. I'll go through some of the various items that were passed as part of that package, and certainly I'll be available to take questions as well after this. But Phase 3, what we really focused on, a couple different areas: individuals, workers, and families, kind of in one bucket. And with that, we do have direct payments that will go out, and hopefully that will be done here in the next several weeks. But direct payments from the federal government for those individuals that are making $75,000 or less, they will see that maximum payment of $1,200. For a couple, if you make $150,000 or less, then that maximum payment would be $2,400. And again, those are the direct payments. And we also have expanded unemployment insurance by $250 billion as well to support our workers, those that have been laid off due to the coronavirus. And all of that will go out to the various states. Another group are seniors as well. What we did, we expanded Medicare telehealth services. We know that our seniors still require various appointments, but they are part of that vulnerable population. And so we are providing dollars to help expand not only the telehealth services, but then the portion that Medicare would pay for those types of visits over the phone or over the internet. So that was a tremendous step forward. We also are providing dollars for the COVID-19 vaccine. So that's a future effort, but we wanted to make sure dollars were allocated for that. There's $955 million that has been provided for the Aging and Disability Services Program, which is very important. They provide home-delivered meals, things like Meals on Wheels, as well as disability services and family community-based services, family programs, and for caretakers as well. It does require Medicare Part D to provide up to a 90-day supply of prescription medications for seniors if they are worried about the COVID-19 and they don't want to get out to their pharmacist. It does require that Medicare Part D cover that cost of those prescriptions and allow for a 90-day prescription. So some great steps there. And for our seniors as well, one thing that I fought for, of course, at the request of many of our seniors across the state, is to make sure that they were included in that direct payment as well, even if they haven't paid into the IRS in the last several years. They will still be included as long as they meet those income requirements. Another group, the healthcare workers and hospitals, we wanted to make sure that they were properly protected. That has been one of the largest topics of interest, I think, across not only Iowa, but the United States as well, and making sure that our healthcare workers and those that are on the front lines working with individuals that might be infected, making sure that they have the proper protective equipment, their personal protective equipment. So we have $10 billion that is going into, or excuse me, $16 billion that's going into personal protective equipment, ventilators, and so forth for medical supplies, and that is through our strategic national stockpile. And then something that's very important to Iowa is the community health centers, and they are spread out through our rural areas and cover a lot of the essential services that our Iowans need in those rural areas. We have $1 billion going to those CHCs. Senator Grassley and I felt that was very, very important. And then it allows our rural health clinics and federally qualified health clinics to also expand their telehealth services, which is something that I addressed as part of our seniors package as well. And then, of course, a package that I worked on with one of the task forces was small business and nonprofits. And what we have done there, we have provided opportunity through the Small Business Administration for emergency-type loans or loans to help small businesses stay open, stay viable through this epidemic or through this pandemic. And it provides these loans through the local lenders. So your credit unions, your local banks, they will be able to lend those dollars to our small businesses. It will be 100% backed by the federal government, however. So what we're trying to do is eliminate red tape where we can and make sure that that the local banks are able to provide those services. It'll be much easier, much faster for our small businesses. The use of these loans, too, can be used for a number of different areas, whether it's operations, payroll support, benefits. And if that small business or that employer retains the workers or rehires those workers after the pandemic, then those loans can be partially forgiven. We felt that was very important as well. And we have a lot of small businesses, just as the governor said, through this pandemic, and just here in the first several weeks, we've seen many of those small businesses close, and we want to make sure that they're taken care of. The ag community, our farmers and producers are going to also receive direct assistance and emergency support. And what we've done is provide additional funding for our inspectors, our USDA food inspectors as well. This is a concern that many people have had is with coronavirus, is the food supply chain, is it safe? So, yes, we want to make sure it is. And then what we've done, something we heard from a number of Iowans that produce alcohol, at our various distilleries, they have been concerned. They would like to help out and support where they can. So what they would like to do is produce hand sanitizer and various types of alcohol-based cleaning products. But there was an excise tax that was involved in that discussion. And so what we were able to do is eliminate that excise tax for those that are converting their alcohol into hand sanitizers and various types of products like that. And then we also have increased funding for commodity purchases, which will not only help our farmers through those increased purchases through commodities, but it also helps our Iowa food banks and those community food programs. So we felt that was very important. But again, folks, this package was about $2 trillion, $2 trillion plus. And we felt that it was so important to get done to make sure we're supporting Iowans and, of course, every community across the United States that's going through this pandemic. And so we did get that done. I'm so glad that the president was able to get that signed on Friday without delay, and we will start seeing those programs kick in then here at the local level very soon. And so, again, thank you, Governor Reynolds. It's such an honor to be included as a part of today's presser. And I want to thank everybody for joining the call. I know this is on our hearts and minds, and no matter where we are. So thanks so much for allowing me to participate today, and I'll look forward to taking questions when the time is appropriate. Thank you so much, Governor.
Thank you. Thanks, Joni. I appreciate that very much. Appreciate the work in Washington on behalf of all of us and that overview of what's included in the different packages that have been signed and gone out from the federal level. We're going to continue to work at the state level and get Iowans the information so they can understand how the state and the federal packages work together to make sure that we're meeting the needs of Iowans hands during this critical time. I also, just before we wrap up and take questions, and I believe Senator Ernst is going to stay on the line, so if you have a question for her, she'll be available for that as well. But I want to take this opportunity to thank the many people and businesses who are making a difference, whether it's through individual acts of kindness or by offering solutions that will impact many. I'll give you a couple examples. Mid-American and Alliant Energy both donated thousands of masks for healthcare providers. Under normal circumstances, their technicians use the mask when working in client homes, but both companies wanted them to be put to better use at this time. So again, thank you for answering this critical need. The Department and the Department of Corrections and the Iowa Prison Industries are producing hand sanitizer, critical PPE items, including masks and gloves that will be, and gowns that will be distributed through our state stockpile to healthcare facilities and state residential facilities managed by the Department of Human Services.